There are currently more than 8,000 Tennessee children in foster care, but what happens when they age out of the system?
Homelessness, addiction, and human trafficking is what awaits more than 70% of foster youth once they reach adulthood. That's according to new data from Belmont University. News 2's Mai Owens reports.
They are stories spanning across Tennessee, all told in hopes of finding an answer.
How can we find actionable solutions that the community can invest behind?
Stories like Emily's, who was 10 years old when her teacher saw signs of abuse and neglect. After being removed from her parents' custody, Emily lived in 3 different foster homes before ending up in a Nashville group home.
They know through their lived experience what worked and what didn't work.
The Belmont Innovative Lab is opening doors into a conversation that's long been had in Tennessee, focused on some of the most vulnerable, foster kids.
The topic of foster youth and child welfare is becoming something that's continuously more talked about. So it's an incredible opportunity for us to be on the front lines of doing some work that helps to shape some of the recommendations.
Their study revealed 70 to 80% of youth aging out of the system in Tennessee face homelessness, addiction, imprisonment, or trafficking by the age of 21, all without proper support.
Lashing out for a number of reasons, a lot of problems that I don't think I even had the tools to deal with. DCS custody at 14.
About a year ago, we sat down with Tristan Sloth. His childhood filled with several high-security placement facilities. That is, until he turned 18. Then, the next hurdle.
The plan was, you're going back home, you're going to be with your mom, you're going to be with your family. And eventually, it got to the point where I was about to turn 17, and I wasn't any closer to getting home.
Which is why Tristan says he's lucky to have walked into another program, part of the Success Stories from LifeSet, a program that helps youth transitioning into adulthood. Just one organization hoping to cut down on the urgent numbers Belmont has found. And after Belmont Innovation Lab finished their study, they were able to suggest recommendations to the state in order to fix the problems, including consistent adult supportive relationships, stable housing options, and access to mental health resources. To read the full report, we have that over on our website, WKRN.com.